Now, moving on, the Nigerian government's decision to address the challenge of brain drain in the healthcare sector by placing a ban on leave of absence for health professionals relocating abroad has generated various reactions from health workers, with them saying the federal government should look for measures that directly address the push and pull factor that draws Nigerians out instead of coming up with policies that hinder them. Speaking exclusively with TV360, Dr. Irewolede said people leave for job satisfaction and the need to work with quality facilities. He advised the ministry to increase the funding in the sector and to make health facilities and housing and insurance more accessible to health workers.
One of such reasons why people leave is job satisfaction of a truth. As an healthcare worker in Nigeria, you really want to be seen offering services. And by that, I mean that you want to see the healthcare work. You want to be in comparable positions with your colleague, able to provide healthcare services at the highest level, so to speak. Not that you are in the hospital, patients come, half of everything that you require is not available, and then you are just looking at the patient and the patient is dying. So we need increased funding in the health sector. That's just the truth. There is no way around it. There needs to be increased funding for the health sector. Then we need to begin to develop our health institutions to be able to match up with global standard, be able to diagnose illnesses promptly and have quality drugs and at affordable prices made available. And also, we need our patients to be able to come to us as at when we can really intervene. That is where the health insurance scheme comes in. That if there is an insurance scheme that covers for people, it will encourage the health-seeking behavior of people, and then people can get services for their for that they require as at when it's not coming when it is so late, and then there's little or nothing that you can do. Other factors include the overall working condition of an health personnel. You see, there need to be some things that are put in place to cater for the needs of these health workers. In not just, I used to tell people that it's not just literal increment in salaries, but availability of maybe social loan services, housing from the National Housing Fund. Make it something that is accessible readily by these health workers.